Let's get going. Thank you. Welcome, everybody. I see we have some new visitors here. Glad to see you all. I should mention there's no laptop use during the lecture. Thank you. Right. Okay. So once again, if anybody has any comments, specifically this time about their midterm reports, or the presentation, or the playground, please let me know. Certainly interested in hearing your thoughts, your opinions, positive or negative. So just let me know. Send me an email. Talk to me later. We got the standard sign up. If you're a community member and you don't get my newsletter, you can sign up here and you'll get newsletters for the next 2.5 weeks. Okay. Okay. And then everybody should have an evaluation form for the speakers today. Okay. So we have the sign up to meet with Dave clipboard. This is really important for students who have either missed a lecture and want to make that up, or if you're a team, to give me an update of what you're doing. Really like to see firsthand what you're doing, so bring your prototypes with you when you meet with me. That'll be awesome. It's a really sort of critical time for your projects. I really suggest that you figure out, which pathway you're going and arrange for contingencies if something doesn't work out. And if you have any questions about what choices to make, I'll be happy to fill you in a little bit. Okay. So about the midterm reports, when I read the report, and it took about an hour for each one, so I tried to go through it pretty thoroughly. I was mainly focused on the wording, the sentence structure, the grammar, the organization, and formatting stuff. And I realize there's a lot of red in all your reports, but don't worry too much about that because it's just practice. It's a prototype for your final report. And reports like presentations require a lot of practice, and there's really no way to get proficient without going through a lot of practice on this. So don't be disappointed if you didn't get an excellent. Nobody got an excellent this time, but there's lots of room for improvement. That's a good thing. Your communication skills are really important. I can guarantee that after a few years, when you get out of Stanford, a lot of the subject matter that you've learned, painfully maybe, is just going to fade away. And the skills that you need to move on are the communication skills, the ability to present yourself well, ability to write reports, write grant proposals and stuff like that. So this I hope is giving you practice for your professional life. Okay. Nobody told me about this when I went to school. I thought I was going to be sitting behind the lab bench, the rest of my life, but here I am. Okay. So the more you practice, the better you'll get. Okay. Now, I'm not the end-all with reports and stuff like that. Maybe the things I've suggested, maybe you think I'm wrong, and that's okay. If you just have to pick and choose, you have to pick the ones that you think, honestly, will improve your report or improve your presentation, as I mentioned. So, okay. So let's move on. So let me have a show of hands of people who are enrolled in ME 113 next quarter. I know there's a couple. Okay. Oh, good. So I help out in ME 113, and occasionally we have projects coming from this class that continue into ME 113. So if you're in that category and you want to continue your project, there is a possibility of doing that. And I talked to a couple people already that seem willing to do that. So please let me know if you consider that. It's a way of just doing 10 more weeks of iteration on your prototype. But it's okay if you're sick of your project and you want to start something different. That's okay too. So, if you can find some more people that are already enrolled in ME 113 and form a team of 4, that would be awesome. But the final decision is made by Professor Nelson. There'll be some additional there'll be some additional assistive technology projects in ME 113 as well. So anyway, so right now the enrollment is maxed out, so there's nobody, they're not taking any more students right now. An alternative to that is ME 114, so check that out in the Explore courses. Okay, any questions about that? Lots of great pictures from the playground. I don't expect you to see them all here, but they're all online. So check those out. Everybody seemed to have a lot of fun. I had a lot of fun just taking pictures of people. So that was great. I hope you had a good experience too. Yeah, awesome. So on Thursday, we're going to have another doubleheader, 2 presenters. We're going to be focused on aesthetics as well as a little bit of commercialization. Jewel Sherman will talk about aesthetics and assistive technology. And she'll draw from a number of projects that she's done, not necessarily in assistive technology, but in other areas as well. And Shah will talk about her project that won first place in the design competition that the Center of Longevity put on, and talk about how she is moving that to market. So that'll be really interesting next Thursday. This coming Thursday. But today we have a doubleheader. We have Robert and Ahmad. Each of them have new products that are close to being marketed, and they're going to tell what pathway they took to get to where they are. So this would be firsthand information on that. So I think we're going to start off with Robert right now, and we'll have a break between the 2 speakers. So Robert, if you're ready, come on down. You might remember Robert and his device from the Assistive Technology Fair that we had.
All right, wow, it's great to be here.
Oh, wait, let me give you the microphone and hand over the presenter.
All right.
So put this on over here.
I'll let you do that.
And put this in your pocket or on your belt.
Clip it right there.
Yep.
Fantastic.
And this is forward, but I got to put your slides.
All right.
I can move this table if you want.
No, we don't need to. So how's everybody doing? Great. Nice to be here. It's been a long time since I sat in your place.
I got an introduction for you. I forgot about that.
That's all right.
Rob has more than 25 years of product design experience, global sales, business leadership experience with computers, communication, healthcare industry. And he's an innovator who understands how to guide solution development from conception to larger scale adoption, which is just what we want to hear. He holds 7 patents, and he launched this project 4 years ago now, with a commitment to develop solutions to address deficiencies in current assistive technologies for standing and walking. And to that end, he's established a company called Core Mobility Solutions. So let's give Rob a answer. Welcome.
Thank you very much. It's been a long time since I've been in the classroom, so I'm happy to be here. I was in your shoes, well, quite a few years ago, but it's turned out pretty well. And I wanted to kind of go through this with you because this is something I would say that's taken many years to be able to do effectively, this whole process from being inspired to bringing a product successfully to market. And so hopefully some of this information will be useful for you. This is not intended to be so much as a presentation, but an interaction and dialogue. So I'm going to try to go through this relatively quickly so we can get to some of your questions and address what your interests are. So I started the Life Glider project because about 4 years ago, I was at a hotel room somewhere bored, flipping through the channels, and I saw this program about the vets coming back from Afghanistan and Iraq, and having these severe casualty wounds, having issues with being able to get back into the standard mode of life, doing typical things that people do. So, and they offered these solutions that seemed really out of whack in my mind, that would require fancy robotics and things that seem to be way out of reach for most normal people. So I thought, well, wouldn't it be interesting to think about why that is? Why aren't there practical solutions available to these heroes that enable them to be restored and empowered to a really good life? And so what I do when I'm thinking about solving any kind of problem is I try to visualize it very clearly. What's the experience that people ought to be having with whatever I'm intending to do, right? I'm an accidental person building this device. I'm more known for cloud computing, business development, sales, and a long time ago, I was a design engineer. But I never thought about designing this device, but having seen that show and thinking about it, it's like, well, there's got to be a better way. So I started to think, what is the experience I want these people to have? And when I think about mobility, people think about going from point A to point B. But when I was visualizing it, it's about actually being at point A and doing the things that you need to do and what you love to do. And then being able to do stuff while you're going to point B. And when you get to point B, doing more of those things that you need to do and that you love to do as well. So it should be, imagine all these folks having severe issues because of casualties, and they're have to have assistance in standing and walking, and yet they're still be able to do all these things. Then you get an idea about what the project was envisioned from the start. So the vision creates a whole roadmap or a whole sequence of things that you come up with that describe that experience. Now, the visual image of people doing things then has to be translated in what's enabling to be that way. So that's basically what this slide's about, is translating that vision into something that you can now design as objectives. The thing I decided right from the beginning is, like, why can't standing be just as comfortable as sitting, right? You're sitting here. Well, why couldn't you be standing here just as comfortably? Why couldn't you be standing all day long and never get fatigued? So that was one of the underlying principles about my device. It wasn't so much about getting from point A to B whatever way. It's standing, engaging life upright and mobile. So the next part of that process is you really have to go and understand what's going on in that market. Why aren't these solutions available that you envision could be? Where is the innovation? Why isn't it out there? So you have to study what's available in the market. You need to look at the number of people that can benefit from your solution. And then you have to understand that, well, this is a problem that, for whatever reason, people are not really solving the right problem, right? And so this happens to be a very big market. However, the addressable size of the market is probably double this size, just because there's not enough good solutions out there. The other part of the discovery is when you're actually looking at where the source of the bulk of mobility problems originating from. It's not from injury or disease or whatever directly. It's actually, when you peel back the onion, why 45% of seniors actually have issues with standing and walking. It's something that you definitely want to avoid when you get older. It really is an underlying cause. It's too much sitting. You know, we've developed all these clever ways to get people happy being sedentary and seated. It starts from when you're very young. Sit down, sit at the desk, sit at the table, don't fidget. Those are actually quite damaging to your health over a long term. And so over the extent of a lifetime, you get into your elder ages, if you've been following that instruction and being sedentary, you have a very high likelihood of having diseases that you wouldn't have otherwise, and you have almost a 50-50 chance of having problems standing and walking. So I have a theory. I have an idea about what this product ought to be. So I have to go build it. And sometimes it's good to do stuff in groups, but sometimes you have to solve the problem yourself. You know, if you're trying to create something new, sometimes you have to iterate and then take that product and then share it with the group, get their feedback. So what I've been doing is what's called lean development, which means I'm doing the work myself to the degree I can. I use other resources. I'm not going out and getting a huge group of individuals to join in the effort and then try to work it. I'm actually going out and figuring it out myself. So I spent 4 years developing where we are today. A lot of it done in my very own garage. Every one of these prototypes I've built has been built in my garage. I've got people helping with welding and bending, but everything else is myself. You have to be prepared to do whatever it takes to have your vision come to become a reality. And this is not an easy path. When people look at this product, they say, well, that looks really simple. And as a designer, that's a high compliment. It's very difficult to figure out how to make something very simple and very practical. It takes dozens and dozens of iterations. It's validated learning. I can't just say, well, I think I've solved this, and then go and say, well, here it is. No, you have to actually go out and engage with people who have the situation you're trying to address, get their feedback, and then iterate. So where we are today is the result of hundreds of user experiences. This is before I've even gone out to try to find funding. I'm doing this to make sure I've got a great product. The funding is to go out and make this real in people's lives throughout the United States and around the world. There's no substitution for doing the hard work and getting the validation and the end user's experience with the product. So the idea is that if you want to make a big difference, you've got to put in a lot of work, a lot of effort to make a big difference. And our goal is to actually transform the experience of someone like this cowboy, Casey, who broke his neck, has been going through a rehabilitation process, and then he got stuck. He got to the point where there's nothing else that was going to really help him. He called me up out of the blue, and now we've continued him on. Now he's going around carrying saddles, 65-pound saddles. He started out with 1 ounce of pinch pressure between his thumb and his index finger. And now he's doing this. This is what we're talking about, restoring people. So if the guy wants to be a cowboy, or restore him to be a cowboy, whatever they want to be. If you want to be a dancer, get restored to be a dancer. And that's what this is about. It's not so much rehabilitation, it's restoration. So, and of course, what you want to be able to do, as I said, is not getting from point A to point B. It's actually having something useful that you can do when you get there, and that you can use your hands. You can do those things you have to do. You can be independent. You can be capable. This guy had 2 strokes. He couldn't get around very well. He could never play pool. He played pool for 80 years plus. Now he's playing pool again. Just an example. That's actually my brother when he had cancer. He lost half his body weight. They gave him a wheelchair, and he couldn't stand up for more than a couple minutes at a time. For the remainder of his life, he had dignity because he was able to stand, take care of himself in his kitchen, take his medicines himself. He wasn't totally dependent on other people. Another big part of this is, you got to be able to monitor people, so it's not just a mechanical device. There's going to be sensors associated with this. It's going to connect in with the mobile phone, a mobile device, and allow people to see how they're progressing. So this is the minimum viable product. It's not the end of it, it's the beginning of the beginning. So how we got here? I decided to commit myself to try to figure out why we have this big gap in the products in the marketplace. And then take a personal responsibility to say, I have that capability, I have the education, I have the experiences that can allow me to do this. That's what I'm going to do, and nothing's going to get in my way. So we started the Life Glider project based on the theory and the idea that this could be possible. 2 years ago, I actually had a licensing agreement with a major durable medical equipment vendor. At the time I was supposed to sign that agreement, it was 6 months of negotiation. I walked away from it because I had to take personal responsibility for making sure it went through the productization correctly. It went through the development of what I call the minimum viable product. And then it actually is going to get out there and help people. So if this is kind of what you want to do for a living, this is the process you have to go through. So I got the patent issued in October. We've got continuation patents. We've got patents internationally that are pending. We've got pilots pending. And this is all before I seek any publicity at all, because publicity before you're able to actually supply stuff just gets in your way. So going forward, this year is all about going from a great product to building a great company. And in order to build a great company, you have to be able to increment both the people that you have and the product that you have. You have to have a broader, comprehensive vision. So we're in the midst of setting this up. In the next month, we're going to be approaching I've got a very high power VC advisor who can open the door at any place in the valley. And we're going to go get funded to be able to execute the strategy. Part of what we're going to do is we're going to do e-commerce 2.0. That's going to enable people to go select the configuration, the color, the things to make it personal for them. We're also going to have what I call a value product. For the bulk of the market, it's just out of the box. Functionality, great. Maybe not all the bells and whistles. Later, we're going to have institutional products. That's for helping people with in hospitals, rehabilitation facilities, etc. And then broadening out the families of products, adding power, adding monitoring, all that kind of stuff. So a big part of what I'm doing right now is spending a lot of time on the supply chain. If you're going to make something that's hardware-based, you got to get a great design, but you got to get a great supply chain, and you got to get a great ability to deliver the product. There's no sense in creating demand for something that you can't deliver, or you deliver that's inappropriate or just inferior. You got to get this right. So that's a bit, kind of a little glimpse on where we see it going forward. But ultimately, this is all about helping people walk, stand, engage in life, do the things that they love to do. I'm getting the patents on a seat version of this. So we're going to address the problem at its source. It's all of us. 2/3 of the population of the United States sits too much. It's causing a lot of the diseases, the crisis in the healthcare system. We're going to go everywhere from the people that need it today to also the people who are working in the school to get them standing comfortably as long as they need to be standing and avoiding sitting as much as they can. So that's a brief snapshot on what I'm working on. I'll leave you with this picture because to me that says a lot. Here's a cowboy carrying a saddle who otherwise without this device can't walk with his hands free. So thank you very much for your time. I look forward to questions and bring them on.
Hold on to that. Okay. I get the first question.
Yeah.
How do you get the word out about this? I mean, I saw you at the Maker Faire.
Yeah.
And I'm not sure that was the best place for you to be, but that's how I found you. But
well, the Maker Faire wasn't about getting the word out. The demand is actually pretty easy part of the problem. My problem, and the reason I went to the Maker Faire was because I was trying to find the right people. You spend all this time building a product that functions quite well. You have to be very careful about the people that join you in that endeavor to execute. So, if you want to build a great company, you have to have great people. So my first objective, and the reason I went to the Maker Faire was not to create demand, was to I was having trouble finding the right people to actually build the company with. I found a number of the right people, extraordinarily helpful. It wasn't about creating demand. The demand's not that hard if you got a good product. It's got to get the people right, got to build the company right. So that's why maybe the Maker Faire was kind of an odd place to go, but there were literally over 4,000 people that stopped by the booth, and I'm looking for 1 in 1,000. So I got 4 people out of that whole event, which was fantastic for one weekend. Sometimes you got to go for the needle in the haystack if you're not finding them some other way.
You were talking about, getting people to form a good company, but how do you get the word out to hospitals and assisted living centers? And where have you been, for example?
The access to them, oftentimes because the right people in those facilities, they're actually very busy people. Hard to find. They're not necessarily showing up at the Maker Faire or at other events. What you need to know is you got to find somebody who's connected in with them and then get personally invited because they believe in what you're doing. And that's by and large how I've got in the door for hospitals, rehab centers. It's through physical therapists that actually work at the hospital. It's through doctors that are dealing with the aging, issues with aging. It's through those indirect means is the best way because a personal invitation, an introduction, will get you further, especially if it's not where you're not from that industry.
Mark has a question.
Could you illustrate how the product works?
Absolutely. So we'll just go around here. Well, there's actually several means, but the most interesting way is actually to get in the device. This is not it's not a seat to sit on. This actually is a seat to promote proper posture, proper gait. It supports your sit bones. And so what you do is you got opposing forces from the sit bones from the hip pointers. And if you want to design a device where people are going to be having pressure against it, it needs to go against the bony portions of the body. And so that's what we've done here. So I can put as little or as much weight on my legs as I want. I use this every day at my desk. I never want to sit down. And the interesting thing that I've experienced, because I really like to observe my own experiences on things, is that as time goes by, I get more energy during the day. I get up in the morning, I get in this, and by 10 o'clock, 11 o'clock, I'm firing on all cylinders. I have more energy, not less. When I'm in a chair sitting down, it's the opposite. I'm going down. I'd have to go get extra cups of coffee, So this is what it's about. Is imagine people who are losing their ability to stand and walk, or have lost their ability to stand and walk, or have a balance problem, which is one of the predominant problems with aging after you've been sitting too much. It's the loss of balance, and if you lose your balance, you feel uncomfortable with standing, so you reduce the amount of standing, which actually accelerates the problems that you already have. The worst thing to do is sit more when you're already sitting too much. So this is kind of how it is. I can go around in my kitchen, I can go cook, I can go reach way down, I can do the Superman pose. The key thing is in the design challenge here is to identify what's the proper way to provide balance for a person. If you see ice skaters in the rink, what they're doing is they hold their partner up. Where do they put their hand? When they're doing all those fancy maneuvers, that person up in the air is doing all kinds of stuff. Hand's right here. Right at this is your center of gravity. So if you control the center of gravity, it's pretty hard to fall. I mean, you can fall. You can go down a cliff. But just doing ordinary things in your kitchen or wherever you're doing, that's the center of gravity, right? Nothing better. Using your hands, that's not in the center of gravity. That gets you stooped over. The more you're stooped over, the more you're going to be stooped over. You're promoting a posture you'd never really want to have. It's never going to restore you. It's just going to continue to deteriorate you.
Going back to your comment about standing at your desk and feeling more energy, how do you plan on maybe in like future stages researching or supporting like the research that's already been done for the health effects of standing? Because I guess when you're in that device, you're not standing in the traditional sense that
Well,
research.
you notice what I'm doing? I'm in here, I'm fidgeting around. One of the key things about standing is you tend to move. There has to be clinical studies. The thing that is the problem with the existing studies today and some of the conclusions about standing, about leading to other problems, that's because people are not supported while they're standing. They do poor postural things. They start leaning. They do things. But my own experience is, like I was saying, about any kind of thing that you think you learn has to be validated, has to be researched, it has to be demonstrated to be true. You can't just say, well, because it seems to be doing that for me, that's the way it is. You know, that's not good enough. Did I answer your question or not?
I guess I'm just curious how, if that's something that you're like sharing as a benefit of your product now.
Oh yeah. Yeah, one of the things, my mother-in-law lives with us, and she says, well, I don't need a walker, but she's starting to have trouble with her balance in that. Only 72. And I said, she went away for a vacation. When she came back, I just said, what if I were to tell you that this was a comfortable alternative to sitting? And she got all excited. Because, I just hate to have to sit so much. But if I stand more than 15 minutes, I have to go sit down again. And so she's just standing an extra 2 or 3 hours a day. She's not using it for walking. I actually converted a bar stool for her to stand. It's an extra 2 or 3 hours a day. Again, that's not proof. But I think the studies will prove that, just the fact that you're standing. Here is a fact. Your body's optimal position is a standing posture like this, with the knees slightly bent, head over shoulders, over hips, over feet. Your circulatory system, your respiratory system, your digestive system all works optimally in this posture. Not when you're lying down, not when you're sitting, not any other way. Right here. And I think that's probably why I feel like I'm gaining energy, because my body, after having laid down all night and had a breakfast and had my coffee, is now operating more efficiently because I'm in that posture. But I don't know for sure.
One last question.
I noticed your frame that they're sort of like a walker. Was there a reason you chose the shape, structure of the frame?
Oh, yeah, it's this is a structure and a means of design that's it's very similar to what many manufacturers are already doing to make bicycles, wheelchairs, baby jogger strollers, etc. So there's an abundance of manufacturing options because of the actual design of this. The structure of it is driven by the function. You can fold this up, throw it in the back of your car, take it wherever you need to go. It can close up even more, so you can put it in a bag and check it in the airplane, take it out, and off you go. So this is driven by function and by cost of manufacturing, ease of manufacturing, because the goal is to make it available for everybody who needs it, and that means low cost, less complexity for manufacture, the simplest form possible.
Okay, in the interest of moving on, we'll have to say thank you to Rob, and you win this bottle of water.
Oh, perfect. Exactly what I need. Thank you.
Rob will be around afterwards if you want to get a close-up. So what we're going to do now is take a little bit of a break. For people who haven't signed in yet, please do that. For people who haven't got a cookie, you can come down and grab one. And we'll start up again in about 3 minutes or so.
Sorry, if you have the time you specifically know, think about it.
Let me ask you, Dave, would you be able to provide everybody the contact information?
Yeah. It'll be on the course website.
So you can, that's probably the easiest one.
No, it's okay. You can go
So
to
I'll sign my names up there, like I did on that?
I'll send you an email.
I think we only have a short break. Maybe
Afterwards.
Should we let you know when we've added one, or you just
Sorry?
should we let you know when we've added one, or do you just hear through it? I'm just asking because the one that I scheduled to sign up for tomorrow is kind of early.
No, it's fine. I can read this.
Perfect.
Let's see, hold on. Let's see what it is here. Let's put it over here.
Okay.
Awesome. And punch it. Do you have a belt?
Yeah.
Okay. Slip it in the belt or your pants pocket.
Okay.
Just latch it in.
Latch it, yeah? Okay. At the belt or here?
Whatever's more comfortable for you.
Okay. Let's put it
Yeah,
here.
just put it right in there.
Yeah.
Forward and laser point.
Okay. Okay, that's awesome. Okay. Okay, awesome.
Friends.
I have some friends out here.
Yeah. Okay, let's get going. Again. Actually, I thought it was going to be extremely complicated, but welcome back, everyone. Our second presenter is Ahmad Aghazi, and he's a serial entrepreneur, and he has a lot of experience in building products and companies in industries such as hardware, software design, and media. He was the creator of a mobility aid called Dom, which is not going to show today, but there's a video online that I can point you to. He was on Stars of Science. He was a winner of Stars of Science, so that's pretty neat. And this was a Middle Eastern scientific reality show. And he received his master's in engineering management with a minor in software engineering from Santa Clara University. He has a BS with honors in production and chemical system design. And recently he completed a course at the Graduate School of Business, the IGNITE program, which focused on innovation and entrepreneurship. He's been featured in a lot of local and international media for innovative products. So he's going to be talking about this process and getting these projects going and his experiences. So,
Thanks, David, for having me, and I'm honored to be here and share with you some insights and lesson learned from my journey building my medical device company or mobility aid device company, CAM Mobilities. Let me introduce myself and give you a little background. So I got into this space almost 10 years ago when my grandmother used to ask us to help her in standing, sitting, and walking. And at that time, I was doing my undergrad in mechanical engineering. And I didn't find a proper solution that helped her to be more independent and healthy. And I was also, by accident, I went to that scientific TV show called The Stars of Science. It's almost like a reality show kind of thing. And they helped me a lot to take the idea to a product. But after I built that product, I didn't know how to commercialize it. So I heard of something called Silicon Valley. And I remember I was super excited to see and learn how to commercialize a product or an idea. So I came here, and as Dave mentioned, I did my master's degree in engineering management and software engineering. And I was very curious to know how to commercialize an idea. And fast forward, I went to, I did a program here called Stanford Ignite. And during that program, I discovered that the whole industry of mobility aid devices is under-innovated. If you can look at all these kind of mobility aid devices like walkers or wheelchairs or canes, most of them are bulky, ugly, and dumb. And there is a stigma attached to them. So I thought, why all these products have not evolved much? And some of these products haven't evolved maybe for hundreds of years, including the cane. So that's why we started CAN Mobilities. We started CAN Mobilities with a vision to enable healthy, independent living for seniors with innovative mobility aid devices. My company still is in a stealth mode, but we're gonna launch a product this year. In this talk, I'm not gonna spend a lot of time talking about the product, but the process of getting an idea to be commercialized. So let's look at how the process looks like. Every company starts with an idea. The idea could come from a class like this one, or maybe while you're taking a shower, and you get this idea that you think, oh, this idea that's gonna change the world, and a lot of people gonna benefit from it. So today we're gonna see how the process that you need to go through to take an idea to a product in the market. So there is 3 main development processes or development phases that you will go through. The first phase, which is customer validation and product rapid prototyping. Then here you'll find product development and taking this validation and create a product, then scaling and manufacturing. So let's start with the first one, the product validation. You got an idea. Then what? One big mistake that a lot of us go through is building a product and spending a lot of time and resources. Then after that, you try to launch it, and you find that no one really interested in it. It doesn't help anyone. So how to overcome that? It's very simple. You need to go and talk to as many stakeholders or people as possible. What I mean by that is, let's say you're developing something for seniors, or a product for seniors. You need to talk, while we are building our product, we talk to over 100 people, including seniors, caregivers, professional caregivers, physicians, physical therapists, and try to get a 360 perspective about the problem you are trying to solve from all these stakeholders. The next thing you could do, definitely, once you got an idea, you could build a rapid prototype. By rapid prototype, meaning that you build a product from existing products. You take maybe a watch, you put it into something, and you create a product. You create, so this is rapid prototyping. So after you talk to a lot of people, you need to sit back and try to do customer segmentation. And why this is very critical, because also it's very challenging. What we did, we thought that we are building a product for, let's say, a Walker users. We talked to a lot of Walker users. Then we discovered the feedback from them varies a lot. And we discovered that this segmentation is not enough. If you are building a product for Walker users, you need to dig deeper and create personas for each one. And we discovered that you could maybe segment this customers or this segment to more sub-segments, including maybe active Walker users or non-active ones, or maybe people who use it for rehab, and so on. And be very careful about that, because it's a big variable. If you cannot define it very well, you will not be able to achieve the product market fit. After you define what is the segment that you want to do, you need to go to create something called value proposition. The simple explanation of it is, what is the solution that you are providing that will help this segment, small segment of people, and what is the value that you will get out of it? So once you create the value proposition, you need to go through a feature list. Let's say you want to help seniors to be more active. Okay, so you need to target the active Walker users and then create the feature list that you think it would be appropriate for them. Once you create this feature list, you can now create a prototype. And you create a prototype in this phase with a very minimal effort. You go try to see existing products, put them together, and just go. And what happens is, a lot of time, you could start with a lot of functionality at this stage. But by the end of the stage, you need to narrow it down after you do a lot of testing and customer feedback and testing. And why is that? Because we as engineers, we tend to like to add more. And we think that if you add more, the product will be better. And this is a big mistake that every one of us maybe will go through. So try to start maybe with a lot of functionalities or features. Then while you're testing, you need to funnel down to the top 1 or 2 features that really will make or will solve the problem that you are trying to tackle. So as I told you, by the end of this stage, you should have a defined customer segment and a feature list that solves their problem, and a basic prototype that has been validated and tested. Once you have that, you could go to the next level, which is now you need to build a real product. And sometimes we think we can build a product from one trial, and I want to build something and just ship it next day. But the reality is, product development is it's an iterative process. It needs a lot of iterations to get it right. So you could start with 2 prototypes first. A looks-like prototype, as you can see here, and a works-like prototype. Let's now talk about the looks-like prototype. The looks-like prototype, it should not be functional. Or it's not supposed to be functional. The core areas, you are building a looks-like prototype for ergonomics, aesthetics, and for user experience. Especially if you are building a product that has a high interaction between the device and the human or the user. A good example of that is a cell phone or a walker or a cane. It's a lot of user interaction there. So you build this and you start this looks-like prototype with an industrial design, sketches, concept, then 3D modeling, then you 3D print the 3D model that you created, and you will end up with something called a feels-like prototype. So you can touch it, you can see it, you can optimize for the user experience and for the user experience and aesthetics of the product. Meanwhile, you need to build something called works like. And the works like, this is the functional prototype, but it doesn't need to be pretty. It could be very bulky, very engineering, a lot of wires coming out of it. It's okay. And the main goal here is to build something that functions like the real product. And if you are building something with mechanical engineering, you can 3D print. If you are building, it has electronics, you can use very simple components of the shelf from SparkFun or, and use Arduino and all these very simple modules that you can buy to accelerate the development. The next thing is you merge both of them. But the challenge here when you try to merge both of them together is that the fitting. Now you built a lot of electronics and how to fit it to the design. So the better you communicate while you are building both of them, if more than one person is speaking, the better synergy and communication happening at the beginning, the easier you could fit the looks like and works like. And after you do that, you will have your first looks like, works like prototype that you can now test with people and get their feedback. But this time, if you have done the previous phase and you got good results, this time you will focus more into the user experience, how these function, or the user experience between the functionalities that you are adding and all that. At this phase, you could build manually maybe 1, 2, or a single digit number of units. But what if you want to move to a bigger sample or test, or you want to go to sell more, or let's say at least for a bigger sample and more reliability for the product, because this kind of product you literally developed it by yourself. You need to go to scale to manufacturing. When we want to scale, manufacturing is a very time-consuming process. And going from a product that you build by your hand to a manufacturable product, it takes a lot of iterations too. So you could start the manufacturing process by producing units in tens of units, maybe 20, 25, 30 units. And why is that? You want to test it with more people. You maybe tweaked it already and all that. But to jump from the previous phase to this phase, you need to do a lot of work. And it's called design for manufacturing. If it's mechanical, you need to make sure that the design could be molded, or or if it's electronics, maybe you need to design your own board and all that. So it's not an easy process. So you need to jump from there to here. But this will help you to get the first step of scaling the product from few units you built by your hand to really higher scale. So after building that, you can go and test it, get feedback, build another 100 or 200, then get feedback, then you could go to mass production. And why this is very important? Because at the beginning, I thought I have an idea. I could go to a manufacturer. I can manufacture 50,000 units of them. And this is always not the right way. Because once you discover there is a problem in the product, later on, you will never be able to fix it, or if you can fix it, it will be very expensive. So you need to make very gradual scaling from tens of units to hundreds of units to thousands of units. And once you launch the product, by that time, you are very confident that the product will function with the same quality that you're aiming for, and customers really like it. Otherwise, you should have been fixing it here. Going to talking to a little bit about assembly. At this stage, you could start assembling the product in-house yourself. You have contract manufacturers for parts, but you assemble the product yourself. And going forward, and here you need to optimize more for product improvement and quality. Down the line, you need to focus more into the unit costs. So you need to focus more in unit economics, how much it costs us to sell that product. It's a long journey, right? The tricky part is this is 50% of the commercialization journey. The other 50% is sales and distribution. So also sales and distribution. So any startup needs to do two main things: to build the product and to sell the product. And to sell the product also, it's a very iterative, like you need a lot of iterations. And if you want to prove that your product is really useful, or people, it makes a difference in other people's lives, you need to prove it by sales. Because sales is the ultimate proof or validation, other than anything else. Because you can say people like it, but they don't pay for it. And in sales, here there is a trick. Sometimes your customers are not your users. Sometimes they are different. And we face that. What I mean by that, if you're building a walker or a cane, your customers could be the family caregivers or senior communities. But our user is seniors who use walkers. So this is also, you need to identify who is who, if your customers are your users or not. And as I mentioned, as you can see here for us, when we started, it was very hard for us to pre-sell. At this stage, once we had like some 3D models and renders, we created a brochure and we started showing it to people, and we started hand selling or manually selling the product. Like, go show the catalog to people and tell them, are you interested? And we have this thing like the square, we put it in our phone and just ask people for their credit cards if they are willing to pay. And if they are not willing to give you their credit cards and you close a sale, this is not a very good sign. What I want to emphasize here is the process of sales. It could vary from, if you want to sell tens of units, you can do it manually. Then you could go more to online to target like senior communities, or to target family caregivers, or maybe you go to senior communities and so on. So we saw all the process, but what about the resources? How to get into the whole process? So you need three main things: money, people, and expertise. So at the beginning, you could bootstrap it. At this stage, you could bootstrap it. You can have your own, you can buy inexpensive things, inexpensive stuff, and build it yourself. Then you could move to maybe be more creative to get money by having grants and so on, or maybe applying for one of the accelerators like StartX or YC to get funding and also to get expertise. But every time you're going here, that you need more and more money and resources. Here could be one person. Once you go through this process, you need more resources, and you need to catch up with that. You need to raise more money. So raising money could be grants, accelerators, or it could be angel investors, or later stages, VCs. And to raise money, usually you need a pitch deck and you need the connections to reach out to these people. And at the early stage, the story is more important than anything. Definitely, if you can have traction, this is very key. but also your story and why you're solving and creating this thing would be really critical. The second resource is people, and people is the most important thing in the whole process. If you think about it, any company consists of people. If you don't have people, you don't have a company, and you cannot have a product. So at early on, you could do a lot of stuff maybe yourself and so on. Then you need to bring people. And once you bring people, you need to make sure they are better than you in certain areas. And at the early on, maybe you need generalist versus specialist. And why is that? Because at early on, you need to do zillion things at the same time. You need to call customers, you need to build the stuff, you need to clean the office, you need to, it's a lot of work, a lot of things, a lot of tasks that you need to go through. And also it has some luck. I'm lucky to have an awesome team who are attending today. Abdullah, Osman, and Gadrin, who joined this journey. And without them, you cannot, without a strong team like them, you cannot be here. And the last thing is expertise. You need to find great advisors and mentors, and also maybe consultants who are very specialized in certain areas to fill the gaps. And this is in brief what I think you need to commercialize. However, I give you just a little bit of what you need to know. So I wanted to recommend to you different books that helped us a lot throughout the journey of commercializing it. And I think it would be very useful for you to read through these books in different areas, from customer validation to product development to sales and fundraising. I hope that was useful for you. If you want to join our journey, please talk to me, email us, or talk to my team. We are happy to have you with us, and thank you for listening.
Okay, we have some time for questions. Maybe let me start off in saying that thank you for elucidating, what's beyond, coming up with the first prototype, because with this class we only do the one prototype. And it's always been my belief that a prototype is easy to come up with, but getting it on the market is probably maybe a factor of 100, 1,000 times more difficult. Is that what you found?
Yeah, I think creating the right product is the core. If you have the right product that solves the right problem, this is like the core of the business. If you get it right, you cannot scale, or it doesn't mean anything to scale it. So I think you need to spend as much time of making sure the product that you're creating is really the right product that solves the problem, so that once you go through the 10x work, it gives back.
Fred?
Appreciate the process that you went through. Can you give us some idea of the product or products that you've done this with?
Yeah, so we have done this with almost like a mobility aid device that has electronics, a mobility aid device that is almost like a consumer electronics. So it has hardware, electronics, software, communication, and yeah, like a data play.
Is that product available for sale?
Not yet. It's still a stealth mode. That's why I haven't talked much about it. But it will be available in the market this year.
And is your product a medical device?
So yeah, it's a great question. So you could start. What we are trying to do, we are trying to launch the product as a consumer electronics. The question is, like, what is consumer electronics and what is medical device? I think it's very tricky here. And the best thing to do is to talk to FDA regulator or expert to walk you through that, because the way you market it, the way you talk about it, all that makes a big difference of labeling it as a medical or a non-medical.
So are you selling your device to, are you going to be marketing to medical providers?
So we are starting it as a consumer electronics.
Because you listed who you were selling to, you talked about caregivers, you mentioned physical therapists.
Right. It could be, they could buy it as a consumer electronics product for them, out of pocket. It doesn't need to be reimbursed by Medicare or insurance companies. So you could still sell them products as a consumer electronics.
Did you show it at CES in the
No, not yet.
When you're developing your language, differentiating from consumer use to a medical device, how do you language it so that it's for consumer without using the word rehabilitation therapy or cure? How do you try?
I think this is a very interesting question. The simple answer that I know is you cannot claim that it has any kind of diagnosis, or I think it's tricky. But you cannot claim that it has any health diagnosis thing. But to get the right answer, I think you need to talk to also like an FDA or expert who could give you a better answer than mine.
How did you come around?
We talk to experts.
So one thing that Peter Asmussen, speaker at the beginning of the year, alluded to a little bit, maybe comment on product liability insurance.
Right.
That could be a big
Yeah.
barrier.
So product liability insurance, meaning if anyone uses your product, then anything wrong happened to them while they are using the product as intended for use, they could sue you and you could run out of money. So before you hand your product to anyone, you need to have a liability insurance. And Gadrian, who has leading this effort the past few months in our company to negotiate like the rates and what it covers and how much it covers and all that, so that while you are testing your product with people, you make sure that at least you are covered and insured. So you don't go bankrupt and go out of business before you launch the product.
Okay, well, seeing no other questions, I'd like to thank Ron and Rob as well for excellent.
Thank you.
Thanks so much for your experience, and this is really helpful.
Thank you.
Thanks again.
Thank you.
So,
Yeah, great. Excellent. Oh, wait, your bottled water.